Hey, I'm Autumn.
Story.
Charles.
Carol. Charlie.
Bubba.
Hey y'all, thanks for coming. You're here today to learn about schizophrenia. Do you know anyone who hears voices that nobody else hears, sees things that people do not see, or believes someone or something is controlling their mind and scheming to harm them? If so, then they may have schizophrenia. But what is schizophrenia? According to the National Institute of Mental Health, schizophrenia is a chronic, severe, and disabling brain disorder. 2.4 million people over the age of 18 in the United States are affected by schizophrenia. Therefore, it is important to be aware about the disorder, the signs and symptoms to look for, causes, and the treatment. Over the course of this speech, I will inform you of the disorder itself, the causes and risk factors, symptoms, and also treatments. If you look up the word schizophrenia in Merriam-Webster Dictionary, the definition will state that it is a psychotic disorder characterized by the loss of contact with the environment by noticeable deterioration in the level of functioning in everyday life, and by the disintegration of personality expressed as a disorder of feeling, thought, perception, and behavior. In psychology, we recognize three different types of schizophrenia: paranoid, disorganized, and catatonic schizophrenia. Each stem from the above stated definition, but also have their own set of characteristics. Paranoid schizophrenia is when a person loses touch with reality. They usually have many delusions and tend to hear things that are not there. The 2001 Oscar-winning film A Beautiful Mind is an excellent representation of a paranoid schizophrenic. In the film, John Nash, a prestigious mathematician, struggles with delusions and hallucinations. Disorganized schizophrenia is marked by thoughts, speech, and behavior that are inappropriate and do not make sense. Disorganized schizophrenia is considered a more severe type of schizophrenia because people with this condition may be unable to carry out daily routines such as bathing and meal preparation. It may be hard to understand what someone with disorganized schizophrenia is saying. Also, frustration and agitation may cause them to lash out. Catatonic schizophrenia includes episodes of behavior at extreme opposite ends of the spectrum. You may seem like you are in a coma-like daze, unable to speak, move, or respond, or you may talk and behave in a bizarre, hyperactive way. Catatonic schizophrenia is rare today because of improved treatment. In fact, being in a state of catatonia is more likely to occur with other certain health problems, including both physical and mental illnesses. With effective treatment, you can manage these symptoms of catatonic schizophrenia and work toward living a happier and healthier life. There are many misconceptions about the disorder. Schizophrenia is not a split personality or multiple personality disorder. The victims are not violent or dangerous to others. It is not caused by childhood experiences, poor parenting, or lack of willpower. It is also not caused by drugs, alcohol, and there is a hope to recovery. Despite the misconceptions, schizophrenia is caused by individual genes, brain chemistry and structure, and the environment. The National Institute of Mental Health states, scientists have long known that schizophrenia runs in families. The illness occurs in 1% of the general population, but it occurs in 10% of people who have a first-degree relative with the disorder, such as a brother or sister. People who have second-degree relatives, aunts, uncles, grandparents, or cousins with the disease also develop schizophrenia more than the general population. The people with the highest risk for the disorder is an identical twin. They have 40 to 65% of developing it over the course of their lives. Unfortunately, it is not yet possible to use the genetic information to predict who will develop schizophrenia. However, the research is still ongoing. Different brain chemistry and structure is also a cause. Interrelated chemical reactions of the brain involving the neurotransmitters dopamine and glutamate, and possibly others, create a chemical imbalance that causes schizophrenia. Neurotransmitters are substances that allow the brain cells to communicate with each other. Interestingly, the brain of someone who has the disorder compared to someone who is healthy looks a lot different. For example, fluid-filled cavities at the center of the brain, called ventricles, are larger than some people with schizophrenia. The brains of the people with this illness also tend to have a less gray matter, and some areas of the brain have less or poor activity. Also, the brain tissues are different. Scientists found that small changes in the distribution of characteristics of the brain cells that likely occur before birth. Some experts think that problems during the brain development before birth may lead to faulty connections. Surprisingly, only about 1% of Americans have schizophrenia. Men and women both are affected equally between the ages of 18 and 45. There are many symptoms of schizophrenia. Psychologists put these symptoms into three different categories: positive, negative, and cognitive. Positive symptoms are psychotic behaviors not seen in healthy people. People with positive symptoms often lose touch with reality. Positive symptoms include hallucinations, voices being the most common, delusions, and thought and movement disorders. Negative symptoms are associated with disruptions to normal emotions and behaviors. These include what psychologists refer to as the flat effect, which is when an individual's face does not move or talking in monotone. No pleasure in life, lack of ability to begin and sustain planned activities, and barely speaking, even when forced to communicate with others. These negative symptoms can sometimes be hard to recognize as a part of schizophrenia and is often misdiagnosed as depression or other conditions. Cognitive symptoms, like negative symptoms, may be difficult to see. They are often only found when other tests are performed. The cognitive symptoms include poor ability to understand information and use it to make decisions, trouble focusing or paying attention, problems with the ability to use information after immediately learning it, and living with these symptoms makes life more difficult for the individual. Fortunate for those who have been diagnosed with schizophrenia, there are treatments for these symptoms. Since the mid-1950s, antipsychotic medications have been available to schizophrenia patients. Just as most medications, these also have side effects. But these include, but are not limited to, drowsiness, dizziness, persistent muscle spasms, and restlessness. These medications are often in the liquid or pill form, and occasionally shots are given once or twice a month. The National Institute of Mental Health states, symptoms of schizophrenia such as feeling agitated and having hallucinations usually go away within days. Symptoms like delusions go away within a few weeks, and after about 6 weeks, many people will see a lot of improvement. Antipsychotics is the most common treatment for schizophrenia. However, psychosocial treatments, rehabilitation, cognitive behavioral therapy, and self-help groups are all treatments that can be recommended to each patient. Schizophrenia is characterized by a broad range of unusual behaviors that cause profound disruption in the lives of people suffering from the condition, as well as the lives of people around them. Schizophrenia strikes without regard to gender, race, social class, or culture. The symptoms of this disorder can vary between each individual. However, hallucinations and delusions are the most common. Medications are available to people who have positive, negative, and cognitive symptoms, as well as many types of therapy. It is also important to remember that the people who are victims of this disorder are not a danger to anyone. In the 2001 Oscar-winning movie, A Beautiful Mind, Nash, a paranoid schizophrenic, states, "Perhaps it is good to have a beautiful mind, but it's an even greater gift to have a beautiful heart."
That was good, wasn't it, y'all?
Yeah,
Very good,
look,
sis. Very
I
good.
enjoyed that.